Now, let's talk about another inherited disease called SCID, which is short for Severe Combined Immunodeficiency Disease. This defect is specifically seen in pure or part-bred Arabian horses. It is a deletion mutation, and like I mentioned earlier, deletions cause a frame shift that leads to a different gene sequence and ultimately a different protein sequence than was desired. It is a deletion mutation that prevents the production of an enzyme that is required for the generation of B and T lymphocytes. As a result, these horses do not have the necessary white blood cells to attack foreign bodies. There is no visible defect at birth, of course, but one can start to see signs between 2 days and 8 weeks of age, depending on how exposed the foal is to viruses and other air or waterborne infections. That being said, the symptoms can vary due to the type of infection, but these include weight loss, fever, diarrhea, pneumonia, and stunted growth. Some of these symptoms, however, are common to newborn foals, so it can sometimes be difficult to tell whether or not the foal actually has SCID. About 3% of Arabian foals are affected with SCID, while about 28% of Arabian foals are carriers of SCID. Now, unfortunately, there is no cure but to keep treating each infection as they prevail. The affected foals usually die within the first 6 months of life, regardless of the amount of care that they receive. So euthanasia is often recommended and carried out on these foals. What we do have complete control over is the future generations of pure and part-bred Arab horses. Unlike the HYPP disorder, SCID is an autosomal recessive mutation. So the ability to determine whether or not an offspring has this trait has to go beyond its appearance, as carriers can appear perfectly normal, like we discussed earlier. Advancements in technology have made it possible for inexpensive blood tests or cheek swab tests to be carried out to determine this. In this chart used by Animal Genetics, we can see the 3 categories that an SCID test result can fall under. The horse can inherit a copy of the SCID gene from each parent and be fully affected with a lifespan of less than 1 year, or might only inherit the gene from one parent and become a carrier. Lastly, it might be lucky enough to be clear of all the SCID traits. With the ease of testing, we can ensure that we do not breed homozygous foals by preventing the mating of 2 heterozygous carriers. If these carriers are bred with normal horses, then we can be confident that they would not produce offspring affected by SCID at all, although they might still be carriers, so further testing would be required. And in this way, researchers believe that eventually they can eliminate the number, like the foals that actually are affected by SCID.